All right, everybody. Good to see everybody. Dr. Michael Miyazaki again here, and I'm excited to have our guest, Dr. Ryan Walsh. And I'll real quickly just read his bio. I want you to appreciate how smart this guy is. Went to the University of Iowa to get his biology and dental degrees. Then he relocated to Texas, went to Texas A&M University, College of Dentistry, formerly Baylor, to get his specialty certificate in endodontics and a Master of Science in oral biology. He's a board certified diplomat of the American Board of Endodontics and an adjunct clinical professor at Texas A&M University College of Dentistry, and has written, published multiple articles. He's lectured all over. I will tell you, I always enjoy listening to Dr. Walsh. I always learn something. And the reason why I'm so excited to have him on here, we weren't planning to do this today, but I had a chance to catch up with him, and we were talking about today the Endo Sealer Solvent. So if you ever have to retreat a root canal today that's been sealed with a bioceramic sealer, you know how difficult that can be. And that's probably the most common type of sealer used today. And so Dr. Walsh is going to go through with us and explain to you why this is so important and how actually to accomplish this. So Dr. Walsh, thanks very much for joining us.
Dr. Mike, thanks so much for having me again. It's great to see you.
Yeah, it's so good to see you too. And let's jump right into it. Why Endo Sealer Solvent? There's never been anything like this before, so
Yeah.
why now?
Yeah, you know, that's a great question, and it was kind of predicated off of questions I got when I was out lecturing, and talking about bioactive materials, bioceramics, and things of that nature. And but one of the first things that I would get asked is, well, how do you retreat it? Well, before we really didn't have a good answer. We've talked about modern retreatment techniques, and that's been a topic of study at AAE. And I've listened to several very well-known lecturers talk about it. And the bottom line is we just don't have a lot. It's mechanical removal of the sealer to the best of our ability. And what I thought was that, well, we have solvent for gutta percha, but not the sealer. And so I think that's where this really bridges that gap of, okay, we can get the gutta percha out well, but what about bioactive sealers? We've known from several different studies that they're very hard to remove. I mean, at their core, they're medical grade Portland cement. So we put this medical grade Portland cement into a tooth, and not 100% of root canals are going to be successful. And so that small subset that need to be retreated, we have to have effective means to be able to do that. And is having a material, or having a solution rather, that helps dissolve this material, but is friendly to the surrounding tooth, that's of good value for us endodontists that are, spending, between 20 and 40% of our practices redoing root canals. And we need to have this at our disposal. And like you said, bioactive sealers are becoming, the mainstay. I mean, over the last 15 years or so, they've just continued to grow in their popularity. And so when they start to become retreatment cases in the future, yeah, we need to have something that effectively helps us in that process.
Yeah, no, that's great. So, you get a retreatment, let's say. I know some GPs do retreatments, but a lot of times if we have to do a retreat a case, we'll refer out to the specialist. So now the specialist has the fun of having to try to get through the sealer, get through the gutta percha, and then in the past, just kind of mechanically instrument it out. But that leaves a lot of sealer on the canal walls. And of course, if this root canal has failed to heal, then we want to put everything in our favor as far as the odds of success. So, what does the endosealer solvent do? Well, let's go through that first, and then we'll talk about the protocol that you use.
Sure. Yeah, so it's a citric acid based solution. Citric acid isn't new to dentistry, but the way this has been modified allows it to, again, be gentle on dentin, which is first and foremost the most important part of what we're doing. But it helps chelate, or helps kind of break down some of the bonds that are holding that bioactive sealer together, so that once those bonds are broken down, well, then we can then irrigate the sealer back out of the canal. So really simply, it just kind of works very specifically on the sealer, targeting those specific molecules to help release them and break them apart, so that we can then flush them back out of the canal space. So on a basic level, that's how it works.
Yeah, so we've shown it in past videos that we've done on these YouTubes. is that we'll take some of the Bioceramic sealer, we'll let it harden. It's just like a cement. And
Exactly.
then you could throw whatever you want on it. Water, it's not going to do anything, but you throw the sealer solvent on top, just kind of mix it up a little bit, and that hardened cement just starts to dissolve and become a white liquid like milk, right? And then you just
Exactly.
flush that out.
Yeah, exactly. Once you get your gutta percha back out of the canal, it then leaves your bioceramic sealer on the wall, and then you introduce your bioceramic sealer solvent or endo sealer solvent. Give it a little activation. I mean, I prefer ultrasonic activation, so use that, and then yeah, you'll see your irrigating liquid turn just like milk, and that's telling you that it's pulling that bioceramic sealer off the wall and irrigate again. Usually, it takes me, I mean, on a one or two canal tooth, 3 cc's, give or take. On a molar that has 4 holes and or 5 canals, maybe it takes 6 cc's. But 3 minutes, 5 minutes or so of ultrasonic activation, kind of all together, and your canals are notably visibly cleaner. And we have some studies in the works right now that are supporting that data that it works well to help target that bioceramic sealer and help dissolve it for us so that we can not only remove it from the canal walls to then clean those dentin tubules beyond, but equally to help make sure that we can gain patency, right? To make sure that we can clean all the way to the root tip effectively and then get all those little nooks and crannies that we know are the crux of the bane of our existence, to get all that area clean.
Yeah, I know you've got the videos, and we'll have to catch up with you at a later time to look at those where yeah, even on the apical end, as you're mentioning, where maybe that little puff of sealer is, using this sealer solvent will actually get rid of that and clean out the lateral canal spaces so that we can go back in. And to clarify the protocol is you would use this to remove, well, you'd probably use a drill or file of some sort to remove the gutta percha to give you access into the sealer, then irrigate the sealer solvent into that sealer, use the activation down there to kind of swirl everything up and mix it up, loosen everything up. Once you have used that 3 to 6 milliliters, and when you irrigate, it's coming out pretty clear now that that white milkiness is gone. Then we're back at treating it like a regular root canal. So it's going to be sodium hypochlorite, EDTA, sodium hypochlorite, correct? And then
Yeah.
just obturate. Yeah.
Dr. Mike, you were taking notes today. I'm
I
impressed.
was taking notes. I wrote
Yeah.
everything down.
No, I
And
mean, you hit it
yeah.
spot on. It's like get the GP out how you normally would, whether it's just with a file, whether it's file and chloroform, halothane, whatever you use to get that out. That then exposes the bioceramic sealer. Use the endo sealer solvent with some type of activation to get the sealer out. And once that's out, now you have nice clean canal walls treated exactly how you would with the rest of your disinfection protocol. For me, it's Chlor Extra followed by EDTA and a final rinse of Chlor Extra, and now we're off to the races.
That's great. Yeah, and those of you that may not have used Chlor Extra is kind of a advanced sodium hypochlorite. So that's just gonna, if you don't have Chlor Extra, but you have sodium hypochlorite, yeah, you're just gonna go through your irrigation
Totally.
protocols again. So no, that is fantastic. And again, yeah, the bioceramic sealers, they do set up great. But when that tooth fails to heal after treatment, I think it's great that basically I'll give Dr. Walsh the credit of helping Vista Apex develop this Endo Sealer Solvent, and hopefully it's going to make. Hopefully we don't have many retreatments, but hopefully when
Yeah.
dentists do have the retreatments to do, this is going to make their life so much easier and the final result just so much better.
Yeah. I mean, it's all about predictability, right? So, hopefully we can make our clinicians' life more simple and more predictable moving forward.
Are you as good of coming up with new recipes at home too? Does your wife say, "Oh, honey, go mix something up," and you just throw some things together?
I mean, I like to cook, but I don't know that I'm that uh, well versed.
I've seen you do some pretty amazing mixing in the last couple of days. So
I'm polishing up my skills.
yeah, you're getting really good. Well, I just want to remind everybody that if you like these programs, hit the like button. It's always nice to see that people like what we're presenting. If you want to make sure you don't miss out on any of this important information, and we are going to have Dr. Walsh back kind of on a more regular basis, please hit subscribe and make sure that you don't miss what Dr. Walsh has to present. Dr. Walsh, as I mentioned, he writes and he's writing articles all the time, but he's also presenting live presentations, doing lectures all over the country, all over the world. So if you see an opportunity to see Dr. Walsh, I would encourage you to attend one of those programs. And what we're trying to do is we're trying to develop this community of like-minded clinicians that want to do the very best for their patients, and I think that's what we all want to do. We're trying to give you tips to be able to do this more efficiently, more effectively, and just to make your clinical life easier. So thank you to everybody who has watched this program. And one more thing before I forget, because I always forget, in October 3rd of this year, 2025, just in case you're watching this program, maybe 10 years after this fact, but it's October 3rd, 2025. Dr. Colnett is going to do an endo lecture, Vista Apex. We're one of the sponsors. So just check down below. I'm sure they'll put a link below this. So if you want to sign up and register, we have a discount code to help you attend that. And it's going to be a really great discussion on some of the advancements in endodontics that I think you'll want to attend if you really like endo. But Dr. Walsh, I just want to say thank you very much for your time. Thank you for the insights, and thank you for coming up with this recipe for the Endo Sealer Solvent.
Well, thank you, Dr. Mike, again for having me on, and I look forward to joining you again.
All right. Take care, everybody. We'll see you again.